Hi, I'm Dr. Danett C, Doctor of Acupuncture and Asian Medicine, Women's Health Specialist, author, and speaker. And today I'm going to be talking with you about a very important topic, a solution towards optimizing maternal health, and that's through using pre-birth acupuncture. So first, I'll say that I'm really happy with the increased awareness regarding maternal health. There's still work to be done in terms of improving care prenatally to make it equal across the board. But I think that there is more awareness and attention on the importance of the postnatal care time. Over the years, what I had seen was that there's so much emphasis put on the mother when she's pregnant, and that makes sense because she has a baby in her, and so the baby's health is totally dependent on her health. But it doesn't end when she gives birth. The importance of the mother's health continues because she's a person, baby's dependent on her, and probably other people are dependent on her as well. And so what I'm putting forth with pre-birth acupuncture is that it become an option for standard of care for women starting from week 37. So pre-birth acupuncture is what it sounds like. It's acupuncture that is given before giving birth. And there's a specific combination of points that have been found to reduce labor time and decrease the likelihood of medical interventions. Some of this work, or more of this work, has been done outside of the U.S., which is where I am currently. There's more things that have been going on with this in Europe in terms of using pre-birth acupuncture. And so I think it could be a solution towards optimizing maternal health and for certain decreasing the health disparities that's seen. There's a lot more information, a lot more conversations happening about the disparity that happens regarding Black maternal health and how we are 2 to 6 times more likely to die as a result of giving birth. And for those of us who do live, I believe that our health can be compromised as well. So, but I believe across the board, regardless of race, that there needs to be a stronger emphasis that's put on the postnatal care time. There's more awareness, but I think that we still have a ways to go. In terms of improving maternal health outcomes, I believe pre-birth acupuncture is something that could help with that. So how it works is that a woman would come beginning week 37 every week up until the week 40. And if need be after that until she gives birth. What has been found by doing this combination of points is that it decreases the likelihood of medical interventions and decreases labor time. This is really important because, as I mentioned in a blog that I wrote, so I write a blog called Yoni Box, and I have an entry called Thank You Serena. And in that blog, I talk some about how glad I was that Serena came out and talked about her near-death experience giving birth, and that she has she's a celebrity, and so people listen to her, and I think that has helped there to gain more momentum around looking at the health disparities amongst mothers, and also just the more real perspective of what it means to give birth. And so in it, I compare giving birth to going into war. And so, yes, it can be beautiful, and you can get this person, it's just a wonderful, amazing thing. And at the same time, it's no joke. I feel like growing up, you'd either see, it's either painted as this beautiful, miraculous, florally thing, or a woman just sweating and panting, but it really is a lot, to put it mildly, and I think that things that are a lot need to have a strategy. And so what I've seen with any war, it should be, is that whoever is going into war is looking to not unnecessarily expend their resources, right? And so the longer a woman is in labor, the more she, and I'm speaking from a traditional Asian medicine standpoint, the longer that she's in labor, the more energy that she is expending, and if it's a long labor, the more likely she is to become depleted. Also, in terms of the medical interventions that can happen, I believe that the Western medical community is amazing and saves lives, and that in the end it's about patient-centered medicine. It's not, for me, I don't believe it's about Western medicine or natural medicine, but what are the roles that we each can play to help a patient have their best health outcome, right? We each have different strengths. When a woman is in a hospital and ends up getting a C-section or an episiotomy, I'm certain that that Western medical practitioner is just doing what they know to do to help the mother be the healthiest and the safest. However, the awareness that I don't think is there currently is to understand that when that cutting happens, it is happening along very important channels and energetic pathways that contain important energies that can for certain decrease vitality and make it more likely for the woman to deal with a condition called postnatal depletion, which is a variety of health conditions, illnesses, ailments that a woman can experience after giving birth, not even just a few weeks after, but some professionals agree that it can extend for years. I wrote a book about postnatal depletion, A Taste of Our Own Medicine, that is available on Amazon and as an ebook, where I detail some of my battle with that illness for many years and how it almost took me out of here. And so I'm very committed to helping other mothers and potential mothers not go through what I went through, and I believe Prebirth Acupuncture is something that can help for certain. So I wanted to put that out there. I do those treatments in my office, and I've helped women over the years have, I believe, they believe also healthier and safer births. There have been some VBAC patients who were vaginal birth after cesareans who were told they wouldn't be able to give birth vaginally, who were able to. And, other women who who had the information and wanted to do as much as they could to help their labor go as well as possible. So if you or someone you know is interested in receiving that service, you can check me out on my website, drdanettbean.com. So that's all for now. Take excellent care and love being a woman.